Hello and welcome. The maximum city of Mumbai is now seeing the maximum number of cases and has been for some time. Almost 20% of all positive coronavirus cases in the country are now in Mumbai and once again have been for some time. The question now is there any reason why this is happening which is beyond perhaps what is evident to those who are monitoring this? Is this something that should be of greater concern than what it is across the country? And more importantly, what are we understanding of the disease and its progression at this point, particularly once again in the city of Mumbai? To talk about this, I'm joined by two experts, Dr. Farah Ingale, a senior consultant internal medicine at Hiranandani and Fortis Hospitals in Mumbai, and also Dr. Behram Pardiwala, again internal medicine expert at Wockhardt Hospitals. Thank you both for joining me. And Dr. Ingale, let me begin with you. So what is the kind of cases that you're seeing today of coronavirus patients, and how has that changed, if at all, in the last 35, 40 days that we've been seeing cases come in?
Yeah, so good evening to everyone. It's nice to chat with you all this evening. And as you've said, I'm attached to Fortis Hiranandani Hospital, Navi Mumbai, which has been made an exclusive COVID hospital. So last 1 month, we have admissions only of COVID patients, that is from mild to moderate cases. Of course, we have made arrangements for the serious patients as well, but so far they've not required any ventilator or other management like a serious patient does. Now, what we are seeing previously, we used to hear that COVID doesn't affect children that much. But as of today, the number of patients admitted in a hospital, there are about 5 to 6 pediatric patients and more coming in. The trend, the symptoms and signs are as usual. They come with fever, they come with cough, they come with breathlessness. More than 50% of patients, in fact, present with abdominal symptoms, gastrointestinal symptoms like abdominal pain, diarrhea, which is also getting very common. Like every second patient complains about diarrhea, about nausea, about abdominal pain. Cough is persistent, fever is there, and also breathlessness. And then apart from that, non-specific symptoms, some of them have conjunctivitis also. Like these are the symptoms which we are commonly seeing. They have typical classical X-ray findings. We did CT scans for them. One patient had hemoptysis, one had hematemesis, typical CT scan findings of pneumonitis, that is the peripheral pneumonitis in CT chest. And of course, the lab parameters, that's typical lymphopenia, and then the ferritin levels are high, the LDH is high, the CRPs, and so on. So we are getting pediatric patients as well these days. We have pregnant ladies also, but I didn't find any different symptoms in pregnant ladies. They are all the same like any other patient. And the course of illness is also the same in them.
Right. Okay. I think there are quite a few things that you've mentioned, which I must come back to. But Dr. Pardiwala, what's your experience been, and walk us through what you've been seeing?
Well, thank you very much for asking me to speak today. As ours also is at the moment a COVID hospital, we have roughly about 70 patients with COVID admitted in the hospital, both in the intensive care units and in the ward. You must understand one thing is that it is now in the community. There is no question about it. And I don't think that that curve is going to go down. The curve is going to go up. But most of these patients, I'm glad to say, are stable. Out of the 75 or 80 patients that we have at present in the hospital, almost 70 of them are stable. 5 of them require really serious intensive care treatment. The presentation that I've seen has been varied. Yes, in our country, we do seem to be getting a lot of diarrhea, a lot of abdominal symptoms. And I think that not only is it particular to our country, but I believe that there was a report that they have found the COVID virus even in the sewage system in Stockholm. So this is something that we need to keep in mind. And that is one of the ways by which perhaps COVID could be spreading. The other thing is, I don't like to differentiate, but if I see the well-to-do patients and I see the poorer patient come in with classical symptoms, cough, cold, fever, breathlessness, low saturation, backache, etc. The better patients don't come like that. They come with mental confusion. And especially the ones with the comorbid conditions. Those are the patients. Just this morning I had an admission, elderly man, diabetic, loose motions. His GP was treating him for fever since 7 days. I insisted on a COVID test, and lo and behold, it came positive. And there was no way you could suspect it in him. Yesterday, a woman staying in a chawl, a Muslim lady, lots of people, coughed. She said, "Doctor, give me treatment." I said, "No treatment, get your COVID done." Now, it's so difficult to get your COVID test done. So we had to cook up a story. Listen to this. You had to cook up a story that she had diarrhea, she had this, and that is how we did the COVID test. The COVID test, we couldn't get it yesterday, but fortunately, St. George accepted her. We admitted her. This morning it came positive. This afternoon she died. So these are the presentations that we get. This is something, I don't know why, but we seem to be losing a lot of patients who fall through the cracks. Because this patient, if we could picked her up earlier, you would have saved her. Yeah? I mean,
and she did not come to you because of stigma? I mean, because we've seen that, this in the past.
Yeah. Patients may not come because of stigma. But if I convince a patient that forget the stigma, let's do it. The labs don't do the test. What do you do? I'm sure Dr. Ingle must be facing the same problem. I mean, in my mind, I'm convinced that this is COVID, but the lab says we will not do it. What do you do? And another, a lot of general practitioners talk to me, and 2 of them have told me that the medical officer, the municipal medical officer told them, if you send for a COVID test and it comes negative, we will prosecute you. I mean, look at that. I mean,
right. Okay, so let me come to that part, and that's an important point in a moment, Dr. Pardiwala. Dr. Ingle, so you talked about 2 things. One is the fact that there were so many more gastrointestinal cases. Are these cases to the exclusion of respiratory symptoms, or or do you see both of them?
We see both of them also. But some of them come with exclusive gastrointestinal symptoms, like Dr. Pardiwala has rightly said. Now, those patients who are admitted in the single ward who are more affording, in those patients, we don't see so much of respiratory complaints as such. But then in general ward, when I go from all 4 sides, people are coughing it's really scary for us, though we are in PP, but you don't know. So it's variable. But then it is already reported in the literature, and that is what we are seeing in our general practice also, that about 50% of patients have gastrointestinal symptoms, and cough and fever is a very common presentation actually to say. Breathlessness, yes, some of them have. And X-ray shows the picture, and even the scans shows the picture.
Yeah. Right, and you talked about pediatric, which is obviously children. So walk us through that. I mean, what is the proportion, and are the symptoms presenting differently?
Children also, most of the children, as Dr. Behram Pardiwala also rightly pointed out, that 80% of patients are asymptomatic. 10 to 15% of patient requires admission. Out of that, 3 to 4% require ICU admission. Children, the thing is, that's very good thing is that most of them are asymptomatic, and if at all they suffer, they have mild symptoms. Up till now, what we have seen is just mild fever, mild cough, and not many of the symptoms. And what we have seen is they recover also faster compared to adults, especially with comorbidities. Like we have diabetic patients, we have cardiac patients who deteriorate fast. The prognosis in those patients is really bad. But in children, maybe because there are no comorbidities, they recover faster also. And they have got mild symptoms. They are not usually that serious. Some of them may become, there are reported cases, but then normally they are mostly asymptomatic or mild and recovered better. Right. The symptoms are the same as in adults, nothing different. But of course, diarrhea and all, they are also presenting with. They come with nausea, vomiting, diarrhea, gastrointestinal symptoms is seen in children also.
Right. And you talked about pregnant women, and what are you seeing there?
Pregnant women also, those who are we have about 3 pregnant ladies admitted with us. One is totally asymptomatic, just because she is positive and she is pregnant, she is admitted. There are no symptoms at all. 2 ladies who are there, they have fever and mild cough, that's all. Otherwise, they are pretty stable. pregnancy is not adversely known to affect COVID also. And the outcome is also not different compared to the other pregnant ladies. So they are all stable at the moment. Most of the patients are stable at the moment.
Right. So does that mean that you're not administering any strong medicine which could also affect? Yeah.
We are giving the medicines, but we have to see if a pregnant lady is there. Those medicines which cannot be given in pregnancy are not given, but then those medicines which are normally we are using for these patients can be given in pregnant ladies as well. So those who are positive, we are giving them medicines which are safe for pregnancy as such, and they are tolerating it properly.
Right. So, Dr. Pardiwala, the case that you referred to about the lady who passed away and it happened so fast. Any further insight into why that happened, and apart from the fact that it was a delayed admission, but any other learning?
Yes, she came in from a very congested locality. She was symptomatic since about 7 to 8 days. She was going down to her family physician, who was treating her for the routine cough and cold. And I think it is high time that the general practitioners realize that they need to have a very high index of suspicion as far as COVID-19 is concerned. Any unusual presentation, anything which is even slightly variable, you should always get it checked. But you can't get it checked. So that is the catch-22 situation. It is, believe me, in reality, it's a horrendous situation.
Right. Okay. So, testing is one part, and we obviously have been all talking about the challenges of testing and the quantum of testing as well. But what about the ability and the infrastructure that we have today? And obviously, the hospitals are now filling up. So, how are you now going to be responding to the next round of cases, which you yourself said is going to be higher than before?
Absolutely. But see what Dr. Ingale also told you and what I've also told you, 75% of our patients do not require hospitalization. Mm-hmm. Almost 75% of these patients do not require. They can easily stay at home. That means that out of the 75, I can discharge 55 patients, right? As I said, in the intensive care, there's only one patient on ventilator. Others are all on high flow oxygen, just about 5-6 of them. That's it. Nobody else is really that bad. Because the municipality says that you should admit a COVID patient, we are admitting these patients. I think it's high time that we now relax the rule a little. That if the patient is asymptomatic, if the patient is young, if the patient has no comorbid condition, if the patient is able to self-quarantine in a single room by himself and he has caregivers, they should be given that option. But
right, my understanding, Dr. Pardiwala, was that in some cases that was already happening, at least in Mumbai.
Absolutely. Now there is many a slip between the cup and the lip. What happens is different people have different interpretations. Some people may accept it. Some people may not accept it. I'll give you the classic example of somebody whom I know very personally, who was admitted in a hospital. He came positive. On discharge, he was still positive. He went home, but the municipality is ringing him up morning and night. You need to be hospitalized. He has no comorbid condition. He is hale and hearty, and they're still chasing him up. So you know what people say is different from what people do.
So what you're saying is...
Can I say something here? Okay, fine, you can finish.
Go ahead, Dr. Ingale.
No, Navi Mumbai, it's a little different here. What Navi Mumbai Corporation has done is, we have CCC, that is Community Care Centers. They have two. One is at India Bulls and the other one is in the city itself. So what they do there also, they've made two sections, one for the COVID and one for the non-COVID. So those patients who are asymptomatic or even mild symptoms, those who don't require so much of medical attention, they can be kept at the COVID CCC center where there is medical supervision. The non-COVID ones, there is no medical supervision. Patients have to take care of themselves and report to the authorities in case they develop any symptoms. But in the positive ones, they are under medical supervision. And then if they develop some symptoms and they require hospitalization, then they are shifted to the hospitals. Because of lack of beds, we have to make this alternative arrangement. And ours is a DCHC, so mild to moderate cases. And then we have the COVID hospitals. definitely number of patients are on the rise, and as of today we don't have beds available in our hospital. There are 3 hospitals allocated for COVID positive, the private ones I'm talking of, and most of them are nearly full. So that is why now these alternative arrangements, and even they said that if the patient is asymptomatic but COVID positive but asymptomatic, they can stay at home, but somebody has to look after them at home. They have to be in a separate room. Temperature has to be monitored morning and evening. The caregiver has to watch on them very closely, and if they develop some symptoms, then they can be admitted. Because test also, when we are repeating, some tests are coming positive after 7 days, 8 days, 10 days also. First test coming negative, second coming positive again, but patient is asymptomatic. So we can't hold them on for long time in the hospital, but we need to supervise them also. So we can shift them to CCCs, or if they are asymptomatic, at home in a separate room and somebody monitors them. That's what we have started doing in Navi Mumbai at least.
Right. So, Dr. Pardiwala, if you were to look ahead, do you feel that if we were to, let's say, send home people who are obviously not serious and really focus on that 15%, then we will not have the kind of load that the hospitals are now beginning to start bearing?
Yes, I would tend to agree with that statement. I think that a lot of patients are cluttering up the hospital just now. And the other thing is that requirement that they should be tested for another swab after 5 days. And mandatorily, they have to be kept in the hospital until that 5 days, right? That also clutters up the hospital. In my ward at the moment, I've got about 5 patients, 2 of whose reports should come in today, 2 whose reports will be done tomorrow, 1 day after tomorrow. They're all asymptomatic. They're all lying down there, and we're waiting for the reports. You can't do anything about it, right? So we have to think a little out of the box. And once you streamline it, I'm sure that you'll get a lot of beds which are available, at least in Mumbai, because you have Seven Hills, which is a totally COVID hospital. HN is taking up another 100 beds over there. So these are available. Nair has been converted into a full COVID, and we are exactly opposite Nair. Yes. So if you can reduce some of these unnecessary admissions, hospital beds really, at least in Mumbai, shouldn't be under so much stress.
Right. So last question to both of you, and let me start with you, Dr. Pardiwala. So looking ahead, next couple of weeks, how are you bracing yourself? What are you expecting, and how are you preparing yourself?
I am expecting a lot of COVID patients to come in. I am also expecting a lot of serious COVID patients to come in because it's in the community now. You still have a lockdown. Just wait until the lockdown opens up a little and you will find a huge surge of patients. You have a huge number of patients in all your slums just now. Right? Just keeping them locked down there doesn't make any sense. Again, remember, it is because of that fear that people don't get tested. If you test, you'll get many, many more patients. What I'm fearful about is that a lot of these patients will require intensive care. So we are bracing ourselves for that. Yes, in terms of manpower, in terms of equipment and everything. Let's hope for the best.
Right. And Dr. Ingale, how are you seeing the next few weeks?
It seems like what doctor said, post-lockdown, the scenario is going to get worse, and we are getting prepared for the same. About the test, because we are not able to do that many tests. One is we are short of kits. Everyone does not afford that. Reports also does not come. And again, because of fear, patients also don't come forward. That is why I don't know how many we are missing on. And most of them are asymptomatic. So naturally, we don't test those patients. So we may be missing on many patients, and then they are the ones who actually spread the infection. Exactly. And post-lockdown, the scenario is going to get bad, and we are expecting a huge surge, and then we are prepared for it. As of now, we will take as it comes. That's what.
Right.
Yeah, he wants to add something.
Dr. Ingale and Dr. Pardiwala, thank you very much for joining me, and I wish you all the best in your efforts to fight this dreaded disease. Thank you very much.
Thank you so much. Thanks.